My name is Mark Stacy. I am a neurologist at Duke University, and it's my great pleasure to be here for the 21st International Congress of the Movehorse Society in Vancouver, June 6, 2017. Today it will be my pleasure to interview my good friend Dr. Stewart Factor. Dr. Factor is a professor of neurology at Emory University. Stewart, thank you for...
So glad you're interviewing me.
Well, I'm glad that we have a chance to talk, and I think it's great to be able to talk about our friendship, which is one of the things that I cherish about the society. Me
also.
Love each other's kids. We've celebrated our kids' victories and maybe not so many victories, and I know that there have been times in my life that I wouldn't have made it without you. So now I'm going to ask you difficult questions.
Well, I know up to this point I wouldn't have made it without you. So we'll see how this goes.
All right. So let's kind of just start off of why did you decide to be a doctor, or how did all of this happen?
Well, I can say that becoming a doctor was really my father's idea. He sort of pounded into me when I was very young that the most honorable professions are being a physician or being an attorney, and I knew I couldn't read all that stuff in law school, so decided to go for medical school, and you know, it stayed with me since I was, you know, single digits. So that was a big push for me. And then going to medical school, how I ended up interested in neurology was, still remember freshman year, we had a class called the neurological exam, and two neurologists came in and they brought movies of people with Parkinson's disease and Huntington's, dystonia, Wilson's disease, and I was mesmerized by these disorders, and I knew right then, before I even knew I wanted to be a neurologist, I knew I wanted to do movement disorders because of that. So that was kind of how it happened.
Yeah. So I know your father was a huge influence on you, and immigrated to this country. Do you want to talk about his ability to pick himself up and what he did and how that made a difference for you?
Yeah, well, he was a Holocaust survivor. He's from Poland. Came to the country after the war, lost his entire family, and somehow managed to develop his own businesses and do well. And became despite an 8th grade education, became a astute businessman, and I admired him forever because he just seemed to know which direction he was always going. But despite all that, he always, you know, wanted more for his kids, and so you know, and I always wanted to do more for him. And I think part of my work ethic came from him because he worked tirelessly. I remember 6 days a week, working very long hours, getting up at 2 in the morning to go to work and coming home around dinner time and going to sleep and starting over the next day. And I actually remember Christmas time he was in the meat business. Christmas time was a particularly busy time for him, and I still remember going to my first NFL game at Yankee Stadium. The Giants played the Rams, and we got home at 6 o'clock, and he said, "You better go to bed." And we got up at midnight, and we worked 24 hours. It was the day before Christmas. I'll never forget that.
That's why you can still meet deadlines.
That's right.
He also instilled a responsibility in you about family, and I know that Anne-Marie and your daughters are the center of your family. Do you want to talk about Anne-Marie and how much she's meant to your career? Or?
Sure. I mean, I met her when I was a medical student. She was a cardiology nurse, and I think we dated 3 weeks before we decided to get married, so it was fairly quick. And you know, we were married in 9 months and moved into residency in Albany, New York. From Philadelphia, I met her. She's from Philadelphia. And she's always been, you know, she knows medicine. She's always been very supportive, you know, of my endeavors in this, and never questioned doing fellowship, staying in academia, you know, always with me when I moved to Miami for fellowship, when we moved back to Albany, when we moved to Atlanta. There was never any question about that. So, yeah, she's I don't think I'd be sitting here with you if it wasn't for her. So.
I would agree. So tell me, your older daughter took her grandfather's advice and became a lawyer?
That's right,
and
ultimately. And she now works at Duke, thanks to you, with a little help from you, and working in research contracts. Mm-hmm. So I never thought she would ever do anything in medicine, and here she is. Yeah. And my younger daughter actually is a pharmacist. She went to UNC Chapel Hill, and they both live in your town. Yeah. And it's great. It's nice to see them doing well. So
one of the things that we have talked about in this series is our regret that we didn't interview one of your mentors. And so I want to talk to you about a lot of your mentors. But mm-hmm. if you share some stories about what Bill Weiner meant to you.
Yeah, Bill's been gone almost 5 years now. It's hard to believe. But when I was applying for fellowships, I actually wanted to go to Columbia. And I interviewed only at 2 places, at Columbia and Miami. Back in those old days, there were only 6 mm-hmm. fellowship programs, and many of the programs, like Michigan and Rush, only took fellows every other year because they only had money for a 2-year fellowship. So I interviewed with Stan, and before I talk about Bill, I really enjoyed my interview with Stan, spent a whole day there at Columbia. Really wanted to, I'm a New Yorker, so I always wanted to stay there. And when Stan rejected me, I remember that same year he took Paul Green, mm-hmm. and I believe he took Heidi Schell, who, mm-hmm. I don't know if you remember her, but Stan wrote me the nicest rejection letter I ever received. He actually said in the letter that if I didn't have a position, that University of Rochester was looking for a position, he would write a letter of recommendation for me, which I thought was just so incredibly nice. Mm-hmm. And I still have that letter, by the way. And but by that time, I had interviewed in Miami with Bill Weiner, and Anne-Marie and I decided we would move to Miami and go there, and never looked back after that. Arrived in July, still remember. Bill went on a 6-week vacation, so I didn't even see him till middle of August. And he left me a pile of work. This was sort of emblematic of what the rest of my career with him would be like. Left me a pile of work, including a book chapter to write, and it gave me an opportunity, actually. There was another person there, Franz Hefty, mm-hmm. who is a PhD pharmacologist, who I worked in his lab for a little while and learned how to do HPLC and other things. But anyway, as you know, fellowship was just a wonderful time, and Bill and I developed a very close relationship that got even stronger as the years went on, and he, probably very much like Joe was with you, he was like a big brother almost, but he was almost like a guardian angel. He looked over me, watched over my career. He was always there when I needed suggestions. He recommended me for things, and I'd say, oh, what is he getting me into now? Yeah. And I was always happy he did. And yeah, he just played a huge role in my life after that. And still, even though he's not here, he still does.
I always thought he was really a very generous man and would just give anything he could to help you.
Incredibly generous. I always remember the story Lisa Schulman told, because of course I was already up in Albany, and I had just gotten into the Parkinson study group, and they were selecting sites for a study. I don't remember which study it was. And so he gathered his team together and said, well, unfortunately we weren't selected as a site for this study, but Stewart was, and that's really great. And Lisa said, who's he? And so he was still just, you know, it was like I was still part of that program. And so, you know, he always looked over things for me and was just great. And did a few books with him, published a few books, and that was always a great experience. The first book we did, the Parkinson's book, we met in Washington, D.C., and we had all the chapters piled up, and we were going through them to make sure everything was right and writing the preface. And at one point in the afternoon, he said, "Oh, come on, it's time to go." And we went to the Smithsonian and saw a special exhibit that was on with the Chinese soldiers. And everything was fun with him. And
Yeah.
so in all the years, I never saw him get mad. I mean, it was remarkable. Only one time did I see him get anxious, and that was the very first time he was doing the controversy section at MDS on dopamine agonists. And he thought he had a 30-minute talk. He thought it was 30 minutes discussion. Turned out it was 15 minutes discussion. He had to cut his slides down. And so he went into the slide room, and of course, then we had Kodachrome slides, and he's looking at slides. And I said, "Do you need any help?" And he said, "Leave me alone." But he did great, of course.
So I think it's important to kind of talk about, people were kind of afraid of him because he was the person that would stand up on the no side for many things.
Yep.
And I think it's important for you to share that I never saw him mad.
Nope.
I always knew that when he stood up, everybody needed to listen because he was going to make us think about something differently.
He was so smart, and he just could see things from both angles, and so always was able to question things. I think one of that very first controversies, Howard Hertig was the moderator, and Howard said, "Okay, we're going to get out our brass knuckles and we're going to have these controversial discussions," and Bill was the first one to speak, and he said, "Howard, no brass knuckles."
Yeah, I remember
So that was what he was like.
Yeah.
And I think you're right. He sort of developed this. He was the person that always took the uncomfortable side of the arguments every year. It seemed like, whatever the controversy was, and I think he really enjoyed doing that.
Yeah. So you've had many mentors, and you can pick one, but I'd like you to talk a little bit about Malin DeLong, if you wanted to talk about him.
Yeah. So when people ask me what was the best thing about moving to Emory, I always say Malin DeLong. He's just been great to work with, and talk about generous people. I didn't know him when I moved to Atlanta, and I was a little nervous about meeting him and working with him, and he is incredibly down-to-earth, nice person, and so thoughtful about everything. Another guy who really could sort of step outside the box and sort of see the whole playing field, and we've had a lot of fun, and he loves to talk about things like what do dreams mean, and is there really a resting tremor, and our video conferences when we're showing cases are just so great because it seems like we're done with the discussion, and then he'll come up with a comment like that, and then we'll have another 20 minutes of discussion on the topic. So incredibly fun, and he loves clinic. He still loves clinic, and I have clinic the same day he does, and not a clinic day goes by where a knock doesn't come on my door, and he goes, "Come here, you got to see this," and so he makes it fun.
Yeah.
It's really fun, even when you're 3 patients behind.
So speaking of 3 patients behind and the world you live, talk a little bit about how you moved your career to what you do right now.
So my career's taken some funny turns, I guess, but I don't know if you know this, but when I went to Albany, during my fellowship, when I worked with Franz Hefty, I learned how to do HPLC and started doing some pharmacologic studies, and we did a project that was really interesting. And when I moved to Albany, I actually had a lab and an HPLC, and my chairman there, Kevin Barron, wanted me to try and do more in the lab, and I wrote several grants. Franz Hefty helped me with these grants, and I tried to get funding to do things like look at cytochrome P450 function in relation to smoking versus non-smoking, and look at, before people were doing this, look at brain levels of vitamin E, and I just could not get funding for that. And then clinical trials started happening, and my first big trial was a phase 2 trial with pramipexole, where we had to, I don't remember if you were one of the sites, but we had to hospitalize patients for 13 days. And and then clozaril came out, and we became very interested in, clozapine became very interested in using that for psychosis. Got my first investigator-initiated grant in that. And so the clinical stuff started rolling, and I wasn't very successful in the lab, so after about 18 months, I decided to close up the lab and just focus on the clinical. And then in Albany, of course, I went there. There were no movement disorder people, and so I was starting a movement disorder program. You know, wishful thinking of what it would be like now. When I went there in the 80s, you didn't have to do very much clinic. And I was doing 2 full days of clinic a week, and there was only one other person doing that, and everybody else was doing a half-day clinic. And all the clinical monies that we got was from doing hospital service. Right. And this was just gravy. By the mid-90s, all that was gone. But so I was building a clinical program, and then building a clinical trials program. I had a nurse, Diane Brown, who passed away in 2000, who was really instrumental in me being successful with the trials, because she just was so dedicated. And she actually volunteered at the very beginning when I first got there. We had this little tiny grant with not enough money. And then Eric Mulho was a resident, and he stayed as a fellow, and after 1 year, I really needed help, so I just offered him a job in faculty, and so he was faculty. And you know, and then the pressures, the financial pressures, really started coming on us, and we started seeing more patients and trying to get more trials. And it actually looked like the movement disorder program was doomed there. We just weren't, you know, it was just becoming very hard, a small department. The chairman wanted to move Eric over to the VA, and then a donor came along, a man named Victor Riley. His wife Lynn was my patient, and he worked for Key Corp, and he donated an endowed chair, and that really, he changed everything for me, because we could keep our program together. We actually were able to grow the program in the ensuing years and do more trials, and I was able to actually do more academic things because I was protected by the endowed chair, so that changed things. And so we got the program up. I think we had 5 faculty. By 1999, I interviewed at Duke and didn't take that position, and then I was really happy when you did. But it was just I wanted to go to Duke, and I really liked the atmosphere there, and at that time, the genetics group was still there. The Vances, yeah, and they had a new building, and it really was some great opportunities, I thought. But, you know, Katie, my older daughter, was in high school, and my wife decided that, you know, she just thought it might be too difficult for her. And then, you know, Albany came up with a counter offer for me to stay, so I stayed. And what year did you go to Duke? Was it
2003?
2003, yeah. So that was 99, 2000 when I was looking there. And so we stayed, and actually one of the great things that I was able to finagle out of staying was to get a 3-month sabbatical. Actually a 6-month sabbatical, but I only used 3 months of it. And I worked with Heidi Payami, who's a geneticist, and that was really a great experience, and that sort of shifted my interests. And she and I, she, of course, being the geneticist, did most of the work, but we wrote a grant through the Fox Foundation, got funding, ultimately, she also had an R01, but she got another R01 to do GWAS after that, and we recruited, there were 4 sites, we recruited over 4,000 subjects. So that was really a great growth thing for me. And then in 2004, not really looking for a place to move, Tim Greenemeyer called me and asked me if I'd be interested in moving to Emory. Ray Watts had left Emory, went to UAB, became chairman there. They wanted a program director there. And so I said no. And Anne-Marie said, oh, we should go look. And she said, but if we go look, I'm coming with you. Mm-hmm. And we went in April, which is the most beautiful time in Atlanta to go. And she actually knew before I did that we should probably move there. And that was really a different experience because now I'm moving into this big program with someone like Malin DeLong and Tom Wickman, who's been my co-director all these years, and all the DBS they were doing, and a lot more science than we were doing in Albany. Other than the genetics, everything was more clinical. And so we ended up moving there in 2005, and it's been a great experience down there. We've actually, when I got there were 11 faculty. We now have 20 faculty. We've grown the program quite a lot, and we do really interesting stuff all the time.
So speaking of the interesting stuff, what are you most proud of? What do you think you have done that really will be something that you'll tell your grandchildren about?
Well, actually, I thought about this when we decided to do the interview, and so of course I'm most proud of the fellows that we've trained over the years, starting with Eric, and you know, we've just had some people who are much more talented than me that we've trained and have gone on to academic careers. So, but aside from that, I'm like most clinicians. I'm kind of all over the place. But in recent years, there have been 3 topics I've been very interested in. You know, Parkinson's disease psychosis, which we've done a number of studies on recently. And I've really become interested in freezing gait. We had a cohort of patients, 30 patients, with this primary progressive freezing gait. It's such an interesting disorder. And 2 years ago, we received a grant to do some really detailed examination of freezing patients and, with imaging and physiology, and we're just finishing that up now. And tardive dyskinesia has been an area of great interest also. And my work with Heide, I mean, we discovered 3 new genes through this GWAS, and actually that's probably had the biggest impact of all of it. So we heard a lecture this morning on neuroinflammation, and it was that HLA gene that was discovered through that GWAS that really turned things around for that. So I'm pretty proud of being part of that.
Yeah. So we entered the Movehorse Field in kind of an interesting time. I always looked at it as Marsden and Fawn kind of started everything, and then there was another generation of maybe 4 or 6 people, maybe 8, that were trying to vie for that leadership. And then we came in at a time where I always sensed there was much less competition and much more, hey, what do you think about this sort of thing? Do you want to talk about that some?
Yeah, I think for sure our generation is, well, you know, I don't know what their generation was like, but we're friendlier and inclusive, and we share what we do and collaborate a lot. I'm sure they did back then also, but there's a comfort in that, I think, and it's exciting to see, you know, when we started, there were just, like I said, the 6 centers, and then we all came out, and it kind of grew a little bit. But now look at this, look at this place. I mean, these fellows are coming out of the woodwork, and
Right.
we have the match program now. There's over 50, I think there's 55 programs in the match. There's probably another 10 that are not part of the match yet, and so there's been this great explosion, and I think I like to think that part of the enjoyment we had in doing this kind of caught on,
Yeah, I agree.
especially with our residents and
Right.
our students.
Right.
And so yeah, it's been, I think that part of it has been fun, and watching it grow it almost was like a blink, wasn't it?
It was.
Yeah. I still actually remember Mark Hallett talked yesterday about the first movement disorder meeting in 1990 in Washington. Were you there?
Yeah.
Yeah, I was there, and I presented a poster that Bill and I did on head trauma and Parkinson's disease, and these meetings just really brought us together.
Yeah, so I remember Dr. Hallett presenting about myoclonus,
Mm-hmm.
and he showed a limb being shocked,
Mm-hmm.
and it was at various frequencies.
Yep.
And
he'd have people vote.
And we
Is
voted
this
about
myoclonus?
myoclonus.
Yeah. I remember that also.
And I remember people disagreed about the frequency.
Yeah.
But it was kind of a surreal moment for me. Like, really, this is what I'm getting into?
Well, I even think now, my wife has some ophthalmologic problems, and she goes to the ophthalmologist, and they do these eye ultrasounds, and they do all this electronic stuff.
Yeah.
And here we are, we're still doing this, So, but that's the part of it we like, right?
Yeah.
The clinical part.
That's right.
Yeah. And most people will tell me, when I interview fellow candidates, most of them say that what drew them to it is what drew us to it, and that is that it's a really clinical field, and we just like that part of it.
So if you had
I thought I would just tell one other story,
All right.
and that was how you and I met.
All right.
Which was kind of a funny story. You remember,
I
right?
do.
Which was, I was in Albany, and one of the stroke person in Albany, he was actually a stroke / neuromuscular person, became chair in your department in Missouri, and you had, it was such an awkward thing because you had asked for a pay raise, I guess, and they weren't going to give that to you, and probably asked for more opportunity for research, and they didn't want to do that. So he decided to bring me in for an interview for your position, and then would pay me more than he was willing to pay you, which I never quite understood. But it's just so funny that that was when you and I actually met,
Yeah.
and we became friends after that. And I still always remember how great it was that I took that opportunity just to go out there just so I could meet you. You ended up in Barrow, so
No, I was. It was a very surreal moment, and
I think
he
I
meant
told
well.
you. I think I told you I'm not going to take this.
Yeah. Well, he meant well, and
Yeah.
he was. But for him to have the outgoing person to have to interview somebody coming in was awkward.
Yeah. And actually, we went to his house for dinner, and
Yes,
he
that
invited you over for
yeah.
dinner, and
It was a long dinner.
yeah, it sure was for both of us. But look how we ended
There
up.
we go. There we go.
Yeah.
If you had advice for somebody who was thinking about movement disorders and wanting to build a career, I guess the first thing I want to ask is, because we talked about this a little yesterday. I was talking with Chuck Adler about this yesterday. We decided we never really have ever had a moment that we knew that we made it. But we had.
I still don't think I made
nobody
it.
does it. But we had that moment where we thought we could.
Yeah.
Do you remember yours?
I don't know. I thought, working with Bill in Miami, by the end of the 2 years, he made me feel like I could.
Mm-hmm.
He always made me feel that way, and plus, I had a really productive fellowship. I published 10 or 12 papers, and so he made me feel like I could at that point, and still somewhat unsure, but still think maybe I can make it.
So I had exactly the same experience with Dr. Jankovic.
Yeah.
He pushed me, he forced me to do things that got me out of my comfort zone, but that was a moment that I really felt as I was like, yeah, I can do this, he'll help me.
Yeah, and he actually, you know, he offered me a position to stay. I'm sure Joe offered you a position to stay, but he advised me to go someplace where there wasn't a program because he thought I could do it, and that was really the time when I thought, okay, I think I can do it.
So that's his generosity again.
Yeah.
He really wanted you to stay, but whatever you wanted to do, he was going to support. That's what I liked about him. And Joe has the same sort of thing. And I think all of us do. It's kind of the nice thing about this field.
Yeah, yeah. And we had one of our fellows just recently was trying to decide what to do with his career and decide to go into private practice. And he felt uncomfortable talking to me about it. And I said to him, don't feel uncomfortable. I said, that he did a great job as a fellow, and this is where his passion is, and that's what he should do. And don't ever think that we would ever be upset about that, because we want you to do what you think you're going to be successful
absolutely
at.
to send someone to another place and take care of people with Parkinson's disease or other movement disorders is what we're about.
That's right.
It improves the community.
That's right, for sure.
So what
I learned that from Bill, I guess.
Yeah. What advice would you have for somebody who wants to have an academic career in movement disorders?
That's always a difficult question, but they really should, well, what I tell all our fellows is if you want to be a movement disorder specialist, you need to be a really good clinician first. And I think that's what we sort of push in our fellowship, to do that. And then to start thinking about what interests them the most and which direction to go in. And so if DBS interests them, then that's what they should start to focus on more. So try to get focused in what they want to do, whether they want to do research or whether they just want to do clinical, whether they want to do trials or maybe take a stab at doing some basic science work. That they should never just think they can't do it, just look for the right opportunity. And I think, like you and I always tell them probably the most important thing in their career is to have the right mentor, have somebody that'll help them along, that they can ask questions for, and that can guide them. I think probably to me and to you and to most of us, even Chuck talks about this too, is the most important thing is having the right mentor to guide you along. So I think don't try to go it alone.
Why don't you talk a little bit about the society? How's the society shaped your career? How did you get involved with society? What kind of things do you like about the society?
Bill made me get involved. No, I'm just kidding. One of the things you mentioned first was, so the society gave us opportunities to build friendships. And so, I consider you and Chuck Adler my closest friends now. And that wouldn't have happened without this society. At least one time a year, we can all get together. When we were younger, we played golf. Now we're old, so we just go out and have beers instead. And I think that was important. The other thing is getting the opportunity to meet people like Stan Fahn and Tony Lang and Mark Hallett, and getting to know them and finding how approachable they are and talking to them about opportunities. And that was very important. Getting to present your work. Over the years from 1990, I think I've taken the opportunity to present work often at these meetings. And if I don't go to the meeting, and I've missed several of them, I miss that, So those are things I've been given the opportunity to speak. I've always been honored to speak for the society. And I've been on several committees, serving with you on the Archives Committee and serving with Chuck now on the Education Committee. I've always thought it was an honor to do that and to give back to the society and try to help this society grow. So, and the journal, I still think of movement disorders as that's our journal. Yeah. And whenever I think about writing papers, that's always, one of the first journals I think about for submitting, because it's our journal, it's our society. So so I think it's been great. It's given us great structure, and I hope it continues to grow, and look forward to seeing one of my friends become president of the society.
So one of the questions that I didn't have to answer in my interview is how do you manage your work and life? I'll preface it to say that when we were growing up, or maybe people ahead of us in medicine, they could pursue happiness, which meant they could make enough money on the floors where they could think about things and not have to really worry about that. Now you can't really pursue happiness and have everything covered. How do you balance that to still stay at home and keep your soul going while you're doing your work?
Yeah, the old question, work-life balance. I don't have it. My fellows often ask me that.
Yeah.
I think I've actually learned a lot in the last few years. I think, in the last 4 years, Bill passed away, and my older brother passed away, and that is what's had me thinking about that more. Prior to this, my wife will tell you that I often was working late, and then when I was home, she wouldn't see my face. She'd see the top of my laptop as I was on it. And and when we would travel, it was always with a meeting, So the Vienna meeting, she came with me, and a couple of other meetings she came. She doesn't come with me to meetings anymore because she knows I'm too tied up. But now I've reached a point in life where I can afford actually to start traveling. In the last 4 years, I think we've started just doing more traveling and spending more time together, and so it took me till I was almost 60 to figure it out. But it's hard because you have to stay ahead in this game. That's all part of the deal, and if you don't, then it'll be difficult. But I think we sort of earned our right to, after all these years, to figure out how to do that. So my wife and I both turned 60 in the last year, and so in September we're taking our daughters and we're going for a trip, and we didn't do that when they were younger, except maybe to Disney World or something. So we're starting to balance things a little more, and starting to think more about what's important and what's not. As you know, I take my daughters to New York, to Citi Field, each summer now.
The Mets.
The Mets, yes, of course. And we go for a weekend, and we fly in on LaGuardia in the morning, and we go to Manhattan, and we go to Katz's Deli, and then we go to 2 games, and then we go home, and it's great time together. My wife says it's great for me to do that with my daughters. And
so as you know, I know Katie well, and she really looks forward to that weekend.
Yeah, we have so much fun. I had season tickets to the Braves for a number of years, and they were my buddies coming with me to the games. So yeah, I think in latter years you kind of figure out where to start drawing the lines.
I have to agree with you, though. If you don't write, and you don't set yourself deadlines,
and you don't give talks, and you don't
move forward in any career.
Right.
And so I don't think either one of us really balanced very well, but our work was our life, and we tried to bring everything into that. And our families understood that. And we modeled our fathers.
Right.
And everything kind of works out.
Yeah. So now we're trying to have some more fun.
Yeah.
But
anything we didn't talk about you want to talk about?
I was thinking about so many things yesterday during the president's luncheon. Did you have a chance to go to that? And all the presidents stood up and talked a little bit about their tenure, and then Stan talked about the history of the society. And I was a fellow in '86 when the society started, and I always remembered that Stan would always write memoranda about the society on his own stationery. There was no movement disorder stationery. When we would write papers, what a pain in the neck it is now to do these websites. Back in those days, you'd write the paper, make 2 copies, write, please review, stick it in an envelope and mail it, and that was it. So things have really changed. But that was just reminding me of those old days and what it was like typing. The first 2 papers I did were on typewriters, and so, but we've come a long way.
When I went to work for Dr. Jankovic, I had never used a word processing. We used Word Perfect.
I remember that, yeah. Actually, Franz Hefty had this gigantic word processor. It was probably bigger than this table. It's really heavy. He would let me take it home on weekends. And the screen was this big, and that was what we would do the papers on. So, I guess I'll just mention, I mentioned Heide, who had a big part of my career. There are a couple other people who impacted my career. There's a neurologist in Albany named Larry Corbett, who taught my class, got me interested in neurology, and remained a good friend. And he's 71. He's still practicing, and so he helped me through medical school, and so I just wanted to mention him because he's still a good friend. I think you met him. He was at my daughter's wedding, and he's a really good golfer. He would eat Chuck up.
I'd like to see that.
So I guess, and Kevin Barron was my chairman, and Kevin was a neuropathologist and a neurologist, and he was probably the best clinical neurologist I ever saw. We used to do these Saturday rounds, and if he didn't know what it was, nobody knew what it was. Right. And he scared the crap out of all of us because he was just, Socratic method. Yeah. And but he gave me my first job, and I had fun working for him. We had some bumpy times, but I probably owe him something. He passed a couple of years ago too. So just thought those are people who influenced my career.
So I think we've now documented that you're one of the nicest people in the world, and I really enjoyed talking with you.
I'm so glad, and I'm glad to have you as a friend.